With a serious illness, or if you're frail or elderly, sometimes a physician will bring up a form called POLST. Sometimes it's called MOST or POST or most. But a POLST is a physician order of life-sustaining treatment. And this is basically what I think of as a cheat sheet to your advanced healthcare directive. It's an agreement between your physician and you or your caregiver if a person has dementia or is unable to make decisions on their own. And it's an agreement that in an emergency, if I was not able to speak for myself, if my heart had stopped, would I want things like CPR? If I was already dead, do I want to try to revive my heart to try to get back to life? Would I want full treatment, meaning would I want to go to the ICU, get intubated, be on a life support machine, get any treatments needed to sustain life if possible? And then things like feeding tubes. Would I want full feeding tube for the rest of my life or for a long period of time? Would I want trial, which is usually in the nose and down to your stomach just for a short time? Or would I say I don't want feeding tubes at all? These are important questions when a serious issue happens, because you can't go and look for a form in your living trust or something. It's you need immediate guidance now, and this is what the emergency medical team will look for when you go to your house. The reason why it is given to people with serious illness is because we need to know in an emergency, knowing that if we give a person CPR or put them on life support or whatever types of treatment, it's not going to change the underlying diagnosis. For instance, if a person has dementia or cancer or kidney disease or lung disease, those things are not going to change just because you have CPR or go on a life support. When you get off whatever treatment, let's say you are still alive and you're able to recover from that episode, it doesn't mean you're recovering from the underlying condition. So that's why it's important to know, are we focusing more on quality of life? And if I'm coming to the end of my time, do I want to be treated in the home? Do I want to be treated where I'm comfortable? Or do I want to do whatever aggressive intervention I can to keep me alive? And on the pulse, sometimes it's in the middle. There's full treatment means ICU, life support machine, all that. Comfort focused means probably hospice or medications, so I'm not experiencing pain, so I can die naturally. And then the third is the selective treatment, meaning, yes, I want treatment that will help my condition to a reasonable degree. For example, if I have an infection that's unrelated to my serious illness, would I want treatment, knowing that it will probably get me back to the state that I was in before? And oftentimes people will say, yes, I want to go to the hospital for reasonable conditions. I just don't want to escalate treatment to the point where I'm at the brink of dying and my disease is progressing, and I don't want all things to do. I'd rather be comfortable in the last moments of my life. So those are the choices. It's not a discussion that we make to scare people or to say you're going to be dying, whether you think you're doing well or not. We know it, we know the truth. That's not what it is. It's really about planning for the future. And oftentimes people will start doing the form and talking about it that yes, they want CPR. Yes, they want all treatment. And it's perfectly reasonable. But over time, if the condition changes, then we look at the form again and make modifications as necessary. It's always a discussion between your treatment team and you as a person, your caregiver. You are the final person to make the decisions, and you have to figure out what's right for you. The last thing I'll say is when you're getting frail or you're elderly, your decisions might be different when you're younger and healthier. So as an elderly person, you might not feel sick or have a life-limiting disease, but you know that you're getting older and your priorities have changed. So that's why it's an important piece of information to have as well. If you need one of these documents, talk to your doctor about it. You should be able to get it in your outpatient primary care or in your specialist offices, and it's an important discussion to have. If you have questions, put it in the chat.